Welcome back from the break. I warned everyone we would start probably at 4:45, and we're at 4:48, so we're going to get rolling as people trickle in with our last panel focused on consumerism and the healthcare platform business. Thank you.
Great. Welcome back. Thanks for those of you who have the tenacity to stay with us all afternoon. And welcome to the people joining us by video. This is the last panel of the Healthcare Summit. And I appreciate the panel before giving a little preview, a trailer of the dialogue here about the role of consumers in the platform business conversation. My name is Kaba Safavi. I'm a global industry leader at Accenture and happy to serve on this panel. And I want to thank Randy and Vince and Jeff for putting it together with us. You have all of our bios on the program site. And I want to dive in the interest of getting us started on time. For the purposes of today's conversation, I want to make sure that we're all in the right mindset. There is a lot of dialogue about consumers and consumerism in healthcare. And it's really important, and it's really important context. We're assembled here today, though, to have a conversation about a particular angle on that question. And it's really in the context of a platform business and a platform business model. And so as we go through this afternoon conversation, what I'm going to ask our panelists to talk about is two things. One of them is, as we think about consumers and what consumers want, think about it not just in the context of healthcare generally, but what are the things that a platform business itself can serve or solve as a problem for a consumer that maybe the market or the people who are supplying goods or services on a platform couldn't otherwise solve. And the second issue is for those people who are actually sponsoring platform businesses, separating them from the actual care providers and other services that are being accessed. What are the things that they need to know, or maybe ways they can create value for the consumer? So it's the reciprocal side of that conversation. And what do they need to know about consumers? So that's the perspective that we want to take. I'm going to start with Sue. And the reason I'm going to start with you, Sue, is that you have looked at what patients, consumers, citizens want from healthcare for a while. And now we're entering into this dialogue about this new kind of a business model, platform business models. And as you put on that reference of knowing what people want and you think about these new ways of finding services, after we've talked about platform businesses this afternoon, how would you tell us we can start thinking about what consumers want, problems they need to solve, and maybe how platform businesses can start addressing those problems for them?
I'm glad we're talking about the patients, the citizens. We use these consumers, these words interchangeably. So I'm glad we're talking about that at the end, because hopefully that's what you're going to remember when you walk out and go have a drink. So what people want, and again, putting healthcare aside, I think is a really good thing to do. It's pretty commonsensical. And it's patients, caregivers, it's clinicians, they actually all want the same thing. We know this. We know this from research. People want to be heard. They want to be respected. They want their time respected. That's something that healthcare doesn't tend to do with patients and families, is respect time. I was at the Veterans Health Administration for several years when we first began standing up the Connected Care Office, and had the privilege and the luxury back then of actually starting from those principles. We really started from the principles of what people wanted, and then we extrapolated into, okay, how can technology provide those services? And we really came down with 4 sort of functions. One was very transactional and logistical, getting appointments, getting refills. The second was just getting expert care. People have issues, they need to talk to someone, they need to talk to a physician, they need to get care. Obviously, with digital, you can do that video and synchronously, but asynchronously, we learned a long time ago about the value of secure email. The third one was data sharing. And we know there's been so much focus, and with the 21st Century Cures Act, I'm so delighted about that, and people can actually get all of their information, test results, notes. That's monumental. I'm happy to say the VA actually did that in 2013, almost 10 years ago. And then the last one was notification, like notify me if you're going to change an appointment. again, back to that respected time. So the challenge, we know that, Danny was talking about 5 different portals and people have a challenge, but when you look at each organization, they do these things variably, and some of them don't do them very well. And honestly, people don't wake up in the morning and say, I need to look at a list of my diagnoses, my medications, and my allergies, which tends to be from the healthcare perspective. So that's the big challenge, is that healthcare focuses on their currency, which is their healthcare data, their visits. And where the great opportunity is from the platform, moving towards platforms, is really aligning with the incentives of both, not what the patient, just what the patients and the caregivers and the families want, but also what the clinicians want, because as you know, their workforce has shrunk. They have very little time. They're exhausted. And what Jonathan said earlier about do the things that maybe they're not doing very well, there's huge opportunity. A good example is nutrition. I'm a physician. I didn't get very much information about how to provide that for people. And frankly, there's other people who can do that a lot better. So the great opportunity, I think, the 2 things are really getting to that digital therapy, the Amazon platform for being able to have a channel for delivering really good digital therapies, whether they're over the counter or prescribed. And then really important, what we need to do is the care between the care, which is automate care management. I think that's the other tremendous opportunity that's just not being done.
Can I ask a follow-up question? You started your answer by saying that patient and consumer can be, for the purposes of the comments, you were going to use them interchangeably. But I know you know that you have different personas, and Mickey made the point just before the last panel wrapped about his skepticism about what consumers want. So I think we have this sort of patient persona, and then we have this consumer persona, and they're interacting. Where do you put the slider? For people who are building companies for healthcare patients who are also consumers, how do they think about the patient persona versus consumer persona?
I think it's a difficult question. I mean, you don't really, we're all citizens and consumers until we get sick. And, I mean, I don't really want to spend a lot of time wordsmithing here, because really I think the focus is to meet the needs of what people want, but also not just what they want, but also what they need, what's going to actually make it easy for people to get the job done. Because they don't think about telehealth and portals and wearables. They think about, I need to get the job done.
Yeah.
No?
Go ahead.
If
please.
I can jump in, I think
Please.
that the consumer mindset, when I'm a consumer versus a patient, I want to be in control over my information. I want to be in control over my own health and what I can. When I'm a patient, I'm in someone else's hands.
Right.
And I think increasingly, people want to be more empowered when they're in a healthcare setting. And so we can talk about the ways that that's happening, but I do think it's happening.
So you're thinking maybe that the nature of even what people want has shifted over some period of time. What people want today is maybe not what they wanted 5 or 10 years ago, if that's the mental model of a provider?
I think their mindset of how they're going to interact with their healthcare providers and how much they're going to try to take control over their own health has shifted.
Yeah, very good. Anybody else want to add a comment to that?
Yeah, I'd like
Mike,
to.
go ahead.
So I think what people want and need are 3 things. They want access to care. They want to be able to do that in a convenient way, and they want to do it at low cost. And so the opportunity for platforms is to target each of those 3 areas and to deliver at scale to help reduce the cost. So I'm the CMO of Uber Health. We provide transportation. That transportation delivers access. It delivers it in all 50 states plus DC. It makes it possible for people to get from point A to point B when they need to get there. That includes not being assigned a time that they inevitably miss because their doctor's running late to get back home.
Right.
And using that access means that 6 million people a year miss their doctor's appointments. That has significant implications not only for that person and their health and their families, but also for the payers and for the systems that are trying to get those people in and take care of them and not have their staff sitting around twiddling their thumbs.
Yeah.
So I think that focusing on access, hugely important, platform opportunity. I think the opportunity for convenience, prescription delivery is actually a really good example of that. 3.8 billion prescriptions a year in the United States. up to 30% of them are abandoned, which means they're never picked up in the first place. The implications of not being able to deliver doses of medications. I'm not talking about complicated specialty pharmacy. I'm talking about antibiotic prescriptions, whatever else you might need. That has major implications for that person's health, their family, and for the system as a whole. We all suffer when 30% of prescriptions are not picked up, and now we have platforms that allow us to deliver items from place to place and move people, move items. And then the beauty of the platform is the cost question. If you only have 3 people on a platform and you just deliver 5 prescriptions, that's obviously a very expensive platform, and it's a very expensive process of making that delivery. Once you have hundreds of thousands and millions of people using that same platform, that scale allows for being able to deliver that information. Your prescription is ready, or your prescription is not ready, as the case may be. I get called probably 3 times a week from a local pharmacy chain, even though I don't need to pick up that prescription, because their algorithm told them that I needed this all the time, when actually it's just PRN or as needed. So there's some opportunities for improvement, but that scale allows them to make those calls really cheaply, whereas if it were just me and my family on the system, it'd be a lot more expensive.
Yeah. Go ahead, Roy.
Yeah, I'll be
Please.
very short. I don't think we want to drag the conversation to this one question, but I would say I don't know what consumers want or what patients want. And I think that different people at different times have different wants too, the same person. So that makes it much more difficult. The one thing I would say is that it's an easier answer when you kind of go down the Maslow pyramid. Instead of saying, I want to control my records, or I want to have the data, I want to have access to healthcare. They're all true, but they're motivated by something.
Right.
And we, especially when we get to a world of platforms, whether it's distribution of electronic care or whatever it is, we have to actually build them to answer much, much more basic things like, how do we give patients the things that we all as people want, like reassurance? How do we give them comfort? I don't want to control my records unless I have reasonable doubt that if I'm not in control of my records, something bad is going to happen to me. And if you tell me and you reassure me that nothing bad is going to happen to me, I actually don't want to see my records. I mean, a big part of healthcare as a patient is not that you can seek care, efficient care, quick care, cost-effective care and everything else, is that you're cared for. That is a very fundamental principle. And I think the part, and we're probably going to talk about trust in platforms and everything else, the part that I think we should focus on is not about what consumers want, but how do we make them feel with the services that we offer them. And that's an opportunity that is literally just opened up in front of us.
This is actually a very good conversation, and I think you crystallized some problems consumers want to solve that can't be solved by service providers individually, but maybe can be solved by a platform business. And I think about when Randy opened, he described 4 areas that I would say largely relate to where a matching of supply and demand is also a problem. You can put this on the list of things that platform businesses can potentially solve. I want to connect that to a next question, and this question I'm going to open, this is for you, Mike, because Uber is actually a very classical platform business. And in the beginning, there was a reference being made to Mayo Clinic and their platform business, and it's actually a particular strategy that I know something about. A lot of the sponsors of platform businesses in healthcare are services providers. And if you really get behind their motivation is to sell more of their services, which is a little different than the motivation of a platform provider who is trying to match. How do you think about that? And do you think that services providers are, in fact, legitimate platform providers in healthcare, or are their motives going to be at cross purposes? I'll just start with you, and I know you probably have a thought on this, Jeff, too, as well.
So I think that service providers absolutely can provide platforms-based services, and to the extent that they are being able to connect networks. And it depends on, now we get into the issue of what's a service provider. Is it just a clinician, or is it a network of clinicians, or a network of networks of clinicians? When you think about the network of network problems, and from a health plan perspective, all health plans have networks, their networks have sub-networks, et cetera, et cetera. That's the platform that they use to deliver the care that their members have, or their plan sponsors have purchased for their members, right? So I absolutely believe that the service providers can act as a platform, and in fact they do. Your point that what that means sometimes is sort of the land grab. So I want to make sure I'm getting the most admissions, or I'm seeing the most hip replacements, or whatever it might be that a particular clinical service provider is getting. That could be potentially problematic. I have less of a problem if they're providing it at lower cost, if they're doing it with excellent patient experience, if they're doing it with high quality. And so I think what we need to do is to hold the platform providers accountable to quality, cost, patient experience, or consumer experience measurements. And when you do that, I think what you find is that we pay a lot of money for people who aren't delivering the best quality, and we're not delivering them for the right reasons, and we're not reinforcing the trust and making sure that people feel cared for. And so I think there's an opportunity from the platform perspective to think about, and I think you're right, the opportunity just opened up in front of us. We can learn a lot about a lot of people very quickly and inexpensively now that in the past have taken a lot of manual data extraction, et cetera, et cetera. So being able to do that, to address the much messier data around things like trust and how did I feel about my care, did I have a good experience, these are the opportunities that platforms can absolutely take advantage of, and that really they should be required to take advantage of.
Do you think that an organization whose primary objective is to provide services can be neutral when it relates to that? Like, can they establish a level of neutrality that someone would say, you're not just trying to steer me back to you, you're actually going to give me choices?
So I think there's a whole other discussion about the benefits of having all of your care within one system and coordinating the care very tightly within that system versus the importance of having a competitive market and the potential positives of competition, including competing on quality, competing on cost, et cetera. And right now, I think in healthcare, we're kind of stuck, and we're not really getting the best of keeping everyone in one system because of sort of monopolistic behavior of some healthcare systems. And on the other hand, we're not getting the benefit of competition in many places because there just isn't reasonable competition. And so I think the question isn't, should it be you can't keep people with your patients within your system, or you have to, go to multiple different places. I think the reality is for any individual patient, they want to have a simplest, easiest, best possible experience. But it shouldn't be because a health plan decided that they have a contract with this network and that's who they're going to push them to. It should be based on quality, it should be based on lower cost, and it should be based on excellent patient experience. If we were able to actually do it that way, I think we'd all be okay with, yes, network, you can capture whoever you want and keep them, but you have to keep them by earning that, not just by getting your assignment and being told this is your population.
I want to ask Roy this, because you've been dealing with this. I mean, you're effectively a business that is not a delivery system, connecting people to a delivery system. What's your reaction to this?
I think there's no question that at the end of the day, when in my business, when you offer digital capabilities for a Cleveland clinic, their aim, rightfully so, is not to give a patient a choice. Do you want to go to us or to the Mayo Clinic? Right? I mean, let's be realistic about it. I think that the platform play is literally going to surface with those entities that actually offer choice. They're at a higher level for the most part. Mostly the pairs would be kind of a good place to start. But the question that they're asking themselves, which ties to everything that we just talked about, is are they going to literally procure services and make them available on their platform, or are they going to be a broker, an honest broker? And what that means is it's a little bit like kicking the can down the street. It means that they are going to expose brands through technology. They're going to expose brands that have labored sometimes decades, sometimes more than decades, to establish trust in the eyes of the people that buy the services. Now, the truth is that because of some of the changes in telehealth, the whole notion that healthcare can be distributed over technology, I don't even think that we're beginning to comprehend what that means. Put aside and whatever we're going to do with state licensure is a different story, but at the point where we're actually creating a system that pools together medical services around the country and allows people to utilize them based on their discretion and not where they live, the whole competitive landscape and the importance of brands skyrockets, actually goes much, much higher than it used to be before. And that kind of comes back to the question of what brand would you choose in order to get reassurance, to get comfort level. So I would say that we're seeing this happening actually much faster than is even perceived right now in the market. We're seeing systems that can begin to broker services coming from one side of the country to another side of the country. COVID has made it very apparent, especially when it was temporary lift of the state licensure. But I think that the competitive landscape, especially for delivery networks and provider systems, is going to get ferocious because of that reality. And we're trying to be truly Switzerland along the way. We're saying we're just a phone company in a way.
Yeah.
You know, we're allowing people to a little bit more, hopefully, but we are. It is very important for us to be net neutral. But what we're seeing out there is ferocious.
Mm-hmm. I'm going to come back to you on this issue. Mike, this connects up to your concept of earning business versus channeling business. Jeff, do you have any thoughts on this?
The earning business versus...
Well, yeah, and this whole idea of, is it possible for a supplier to be an honest broker of a platform business when it might cut against their primary motivation, which is to channel business to them? The earn versus steer.
Well, I don't think that you have to be an honest broker to be a platform, to be honest with you.
Okay.
So I think what you want to do as a platform is to be able to create value for multiple sides of an equation, right? Do you have to be a neutral broker? Not necessarily. And I think one way that the technology companies are doing this, and I do think there's a big consumer revolution around platforms right now, is around devices. Smartwatches, smartphones, we all have these devices. About 90% of us have smartphones. 60% of people use those for health and wellness. 40% of people have got a fitness tracker. In the consumer research that we're doing, people are saying that they're finding that these are having a positive impact on their health. Why? Because the big technology companies not just have the devices, they have open APIs, they have health and fitness applications and a whole bunch of providers who are giving them meditation apps, the ability to track their heart health, their sleep, their stress. And so they're finding that this combination of the device and all the sensors, the spectrometers and so forth in these devices and the applications are helping them become healthier. Now, they're not doing that altruistically because they're selling all these devices. And they want to become profitable by brokering that patient information with electronic health records and so forth. But they are giving consumers a lot of what they want, which is access to health, access to information about themselves, and what's been especially important since COVID is the ability to understand your health and to be able to advocate for yourself in a healthcare system that can be quite opaque.
It's very interesting. I thought that was a very interesting point about, you said not honest broker, but in a sense what you described is more, there's a value proposition that's explicit and transparent, and people can choose to buy into that if they want to.
Yeah. It's value creation, and the value creation does not have to be an honest broker or a neutral model, I don't believe.
Yeah, very good. Very good. Jeff, I want to actually take that comment and go in a slightly different direction, because we talked in the beginning, there was a discussion, the day opened with one of the platform problems being the so-called cold start problem. And the history of platform businesses is oftentimes someone has to subsidize either the buyer or the seller for some period of time to get a network effect. And a lot of platform businesses, the subsidy goes to the customer. In this case, it might be the patient. How are we stuck in that cycle? And are we going to have to be, is someone going to have to subsidize the patient to get platform effect? Or are there lessons we can learn from other sectors? How do we get around that problem or address that problem?
Well, I think the way that the technology companies are, which I've described, using the devices as the way to bring people onto the platform is a really important one. So it's not a cold start if you've got 1 billion smartphones and many millions of smartwatches. At that point, it's a matter of convincing people to use your healthcare applications. That's where all these thousands and thousands of application providers are providing these custom applications to help you deal with everything from your heart health to detecting Parkinson's, right? So they're creating that ecosystem, something that wouldn't be possible through another business model, right? And then finally, when the consumers are using these apps, they want to share that information with their healthcare providers. So there's a push from people who are keeping track of their health to the provider. Look, I want, when I have a consultation, I want this to be in my electronic medical record. I want you to take this into account. Or if I've been diagnosed with something like atrial fibrillation, I don't want to just have a cuff every now and then. I want to be able to show you my historical information over time. And a lot of these applications deliver that value. So then, in this model, you've got the consumers through the devices, you've got the application developers, and then if you've got that group, you're going to end up de facto having at least some of the attention of the providers.
So is it fair to say what you're really describing is somebody that has a pre-existing relationship with consumers that could be described as an existing network, then putting other things through it rather than building the network?
Yes, absolutely, especially if you can end up solving the problems that the consumers have around healthcare. So you've got to solve a consumer problem, not just have a tangential relationship.
And that becomes hard for a new entrant. Sue, I know you have some thoughts on this.
So let's not, there was a question earlier in the day about the relationship, that personal interaction with clinicians. And we can't lose sight of that because it's unique, for one. But the other thing is that we can leverage it. So we learned, for example, with video telehealth, clinicians start seeing people in their homes. They start learning things that they wouldn't know. I've heard you talk about this, Roy, a lot. So, new information, new context. You gain more knowledge about that patient. That patient ends up having more trust. And so that relationship is only enhanced. Same thing happens with things like secure email. The number one factor of whether someone will actually go to the portal, if they can get in there easily, and use it and send a message, is that somebody in the clinic suggested it, particularly the physician or the provider. So let's not lose sight of the fact that the team has to be embracing this because they learn that it'll actually cause less work for them. And as a result, you get that value usage feedback loop that Vince was talking about earlier.
Yeah, very good. Roy.
Yeah, I'll just jump in. I could not agree with you more. And I think the part, and Danny, you were asking before about how do people log into all of these different portals and all of that kind of stuff, how we're going to solve that issue. One thing that we've learned over COVID, our business has been mostly, the volume of our business, of telehealth and everything, has been mostly driven by people's convenience prior to COVID. Mm-hmm. And we thought that we had it nailed. We thought that we mastered it and we know how to do it. COVID showed up. Clinicians started using telehealth for a variety of different reasons, mostly not because of altruism, but because of the financial reality that you got to see patients through telehealth because that's the only way for you to submit claims. And the reality was that the volume of telehealth that's now being done as telehealth that is clinician prescribed rather than consumer acquired is orders of magnitude larger than urgent care and even consumer acquired behavioral health or whatever it is. So to your earlier question about who do you incentivize, we always think about, consumers are the one getting they're logging into the platform and everything else. Let's not make the mistake of thinking that means we need to incentivize them. Healthcare in general, I think for the most of us, is we do what our doctor tells us to do. Mm-hmm. And it's designed that way because it gives you reassurance that someone else can handle what you're throwing at them. So if we think about incentive models for platform utilization, it's really more about can we convince the masters of this art to take advantage of those platforms and communicate the value to the consumers. And then consumers will follow that much more likelihood than if you give them a coupon or any kind of prime the pump kind of financial incentives, in my mind.
Yeah, it's interesting. We've been studying consumer adoption of digital health, so not necessarily platform. And we've noticed that over the last 4 years, the rate of adoption has basically plateaued. It hasn't really increased. It went up and then stopped. And there are 3 reasons. One of them is it doesn't fit into their provider's workflow. And if it's not part of the workflow, it's a curiosity, but it doesn't have any persistence, and that's part of the stalling part of it. It's very, very good. I want to take this conversation, and I'm going to bounce back to you, Roy, because you made the point about payers. One of the things about platform businesses ordinarily is that there's a transaction between a customer and either a product or services provider that's straightforward, and a value exchange that's straightforward, and the platform sponsor is figuring out how that works. But for healthcare services, 85% of total spend is coming from someone other than the individual consuming the service. So you have this third-party conversation. How does that work? vis-a-vis a platform business and a sponsor? Is that an accelerant? Is that a hindrance? You talked about going to the payer. It sounds like that's an accelerant. Or should I think about it differently?
Yeah, I think it's a fascinating question because almost by definition, when we think about platforms and other example, Amazon or whatever it is, the thinking is transactional, right? I mean, it's a brokered system. People come in with a need. There is a supply of certain options that you can pick from, and through a variety of different rules, you pick the one you want, and you're done. That's it. We know that most healthcare is relational based, right? You establish a relationship with an entity that has or develops credibility in your eyes, and that relationship is coming from the provider side of things, not from the payer side of things. But the payers are the one facilitating that relationship. So I think we're coming to a very, very unique model or complicated model, like healthcare never fails to make anything more complicated. A model where the platform that we're talking about exhibits provider services, but that the access into the platform is actually sponsored by the payer. In a way, this is not rocket science. We're creating a digital equivalent to what's actually happening in brick and mortar medicine, right? That you look at your payer website to find the provider network that is part of your product, and that's how you go to them. I think the balancing act that I think a lot of people are really struggling with is, so what is the balance of brands that need to be visible there? Is a payer going to be more successful in offering a world of digital services through their platform if their brand actually is all the way to the back, almost invisible? Your point about honest broker or not honest broker? Or are they going to make a name for themselves by saying, we are whatever that payer is, and through us you can get to a lot of different people, but we are the biggest broker. We're the Amazon or something like that. I don't think that we know the balance to that, but that is probably an existential question anybody wants to get in the platform.
And I want to come back to that question through the lens of trust. But Mike, Uber Health is legitimately a platform business serving this multi-party transaction. How are you thinking about it?
So I think about it a couple of different ways. So there are three sort of sponsors of healthcare. So there are payers, there are the employers, and there's the government, simplistically, right? What do the payers need first and foremost? Members. Because you can't have a health plan, you can't grow unless you attract members and keep them. And so if your health plan is better at offering benefits and access to those benefits through an easy-to-use portal, or whatever term you want to use, you're going to be more successful. We see this today in Medicare Advantage with supplemental benefits, where there are certain markets where there are cash cards being given out, benefit cards. And if you don't hit like a certain minimum, $50 a month or $100 a month, you're not competitive against the other plans. And so I think the plans are looking to be able to leverage these platforms to say, okay, we're not just going to give you $100. We're going to give you a card. That card connects to this platform. You have access to these brands, to Roy's point, and that's great. I want to stick with that health plan because that's who's giving me what I need. On the employer side, they're faced with the Great Resignation. They're faced with the need to not only retain their employees, but to attract new ones. And health benefits, especially in the news a lot, is family-forming benefits. This is an opportunity for employers to say, hey, here's a platform you can go to. You can get whatever you need for family-forming benefits, for your healthcare needs, for fitness. And I think the same is true for the government. The Medicaid plans that provide the majority of non-emergency medical transportation, they pay for between $1.5 and $3.5 billion a year in the United States. They want to make sure that they're providing to the right people to get the most benefit and that their governor is going to be reelected next year or whenever they're up for reelection. Our thinking at Uber Health is that we need to create the efficiencies by bringing together the disparate pieces of the healthcare system in one simple place where they can go and get what they need. So today, if you're looking at Uber Health, and we're a company that's 4 years old, we're a subdivision within Uber, we have 3,000 clients, actually 3,500, we've added 500 this year. Our volume's got up 90% ride volume year over year. That's because what we do is we provide transportation that people need. And so that's why you're seeing the market reward us and tell us, great, and we're doing it with applications that are integrated into the clinician's workflow, vis-a-vis the discussions earlier about how to make this actually work. And that's great. But what we see as the future is being able to have not just that ride to and from a physician or wherever you need to go, but also the prescription dropped off at your home, We want to deliver the meals to your home, healthy meals. We want to be able to, if you have your health plan covering 14 meals post-discharge, we want to be able to deliver those meals for you. We want to be able to access telehealth. So if there's a need, if Amwell decides you want to connect into our ecosystem, great. And by the way, if we want to connect in your ecosystem, maybe there's a way we work that out too,
Yeah.
right? So the beauty of the platforms is you don't have to pick one. You can start to connect all of these different services and make it much simpler, better, easier, especially when you connect the feed from the health plan that says, I'm entitled to 22 rides a year. I'm making this up. I've used 18. That means I have 4 left. Today I have to call a plan, I have to get this, I have to go online. Why can't I just go to a simple place? Oh, I want to order a ride to my doctor. I have 4 rides left, approved. No need to talk to anyone, no need to process anything. Same's true for the prescription delivery, for the meal delivery, for whatever else the health plan is offering, and other services like access to providers through technology, which may be a benefit for the provider systems or for those who are providing access to that kind of technology to those systems. That's the future.
And
that
so
we see.
what I hear you, what I hear you saying is essentially the plan has a motivation to be the economic sponsor of a platform, even though they don't derive any benefit from the transaction. They derive a benefit outside of that transaction. And so that's the reason for them to stand up the platform.
And the same is true for the providers, where if they're taking financial risk,
Yeah.
so if I decide as a patient that I'm going to go to the emergency room instead of urgent care, that's a big decision. If I'm working with a transportation company that knows that this is the in-network urgent care that's in the neighborhood, and I can get you there in 10 minutes after a video visit because the clinician on the video visit told me I needed to go there, fantastic.
Very good.
Let's do it.
Jeff.
I don't want to lose sight of a really important payer in all this, which is the consumer, him or herself, because we've got big deductibles, we're paying a lot for plans, and part of what I think a platform can and should do for us as we pay is to provide more cost transparency, right? If I'm paying $3,000 a year for my corporate plan, I want to know, plus deductibles, I want to know what I'm getting for that money. I want to know, can I end up getting care in a cheaper way? And I think ultimately, when we think about what people need out of platforms, is that the providers, the payers, and the consumers are all going to have more price transparency, especially as more cost burden gets shoved onto the shoulders of the individual.
Mm-hmm. Totally agree. And in the case I mentioned, if that person needs a ride, and this is their 23rd ride, and they only had 22, we should be able to tell them it's going to cost you $20 each way, period. There's no need for them to go somewhere else to sort that out.
Right. Right. So did you have a comment?
I would say to be truly aspirational, we need to combine both sides of the coin, what people want, and they certainly want to pay less out of pocket with the tremendous amount of research we have of what people need to have better health, particularly for chronic conditions. And so if there's a way to marry things like, not decreasing premiums, not to get people engaged and connected to some of the transactional services that are definitely going to make it less painful and more joyful, with the ability to sort of reach out to them, Netflix-like, and with the clinician saying, oh, you should do this, to get them and nudge them and do that automated care and digital therapies.
Very
because that, to me, that's ultimately the win-win, is both sides, not just what they want, but what they need, and going to decrease for the payer.
Very good.
Keep them out of the emergency room. That's what they want.
I want to loop back to a concept here as we're getting to the end. You raised the issue, you used the word trust, Roy, and we talked a little bit about this concept of the neutral party. That research I described to you about adoption and the plateauing, trust was the #1 reason for plateauing. And you heard Mickey make comments about it. People aren't really, if the monetization is my data or advertising to me, there's skepticism. All of this gets to, do you actually trust the entity that you're engaged, the platform business that you're engaging with? From your perspective, Roy, what needs to be true to be trusted enough to be a successful platform business?
I think humility of the platform to understand that you're a distribution system for other people's credibility, not yours. And that if you do a good job in doing that and essentially step into the background, then you are likely going to be successful or unsuccessful based on the credibility of the entities that distribute over your platform. And I think, healthcare never fails to show us that the traditional players prevail, the newcomers for a variety of different reasons. And if we want to create a platform that's going to, in a way, disrupt the way people experience healthcare, we can do that without having to disrupt the brands.
Yeah.
The brands are okay. We don't have to fight them. We just need to allow and facilitate their way of reimagining the way that they're available or helping patients. And I think that's possible. And one of the last things that I just want to add to the point that you made, and you made it earlier, the opportunities in platforms go beyond just delivering the same thing through a website or through a technology. It's the opportunity for us to also play a role in the life of patients in places where the providers historically don't exist. Most clinicians, most health systems care for patients where the patients are in front of them. There's a whole span of time that patients live without clinicians in front of them. That space between visits that you talked about, technology that is mostly going to be represented through platforms and their experience with patients can actually be always on. One of the value proposition of platforms is what are the added benefits, what are the added experiences that they bring into the mix that are not just shuttling services back and forth from whoever you broker it.
Very good.
And I think that's a big part of their value.
Good. Any other thoughts from the panel on this issue of what you need to be a trusted platform business? Jeff?
I think you need transparency in how you make money, so people understand how you're making money. There's got to be transparency in the data you collect and what you do with it. And there's got to be control. The patient has got to have control over their data and their interactions. And I think as long as you've got that level of honesty and you're giving people a lot of control, you're going to have a lot more of that trust. And I think that's especially true of the types of services that are being delivered through smartphones and smartwatches, where it is continuous monitoring, but it's also a lot of personal data flowing, right? And so people have to be, they have to understand that data is going to be preserved, right?
So follow-up question for a couple. So if I'm a platform services provider and I meet your test, does it matter if the category of the business that I happen to be in is what the market would know as an insurer or a provider or a retail pharmacy or a tech company? Or does that not matter and it's my behaviors that matter?
Well, there's the concept of brand permission that I think is still really important. You know, do people associate you with healthcare, the level of care, the technology, or something like that? If they don't, then you've got, I think, a steeper hill to climb.
Yeah.
I'll just say, are there bad products on Amazon? Sure, plenty of them, right? There is some Darwinism in all of this that means that if you're launching a product through a platform and it's bad, at some point you will be marginalized. And it doesn't matter if the product that you offer is coming as a payer or coming as a delivery system or whatever it is, you have to be very good at what you do. That's it.
One comment about data. You know, in an electronic health record, there's a ton of data, but a lot of it isn't really about the patient. It's about their diagnosis. And we've learned a long time ago that you could get information directly from people digitally, and it's more accurate than asking somebody, having one of the healthcare team members. So so not only can you have more accurate information from patient-generated data for most people, maybe not everyone, but you can actually, because we have such workforce problems and we've got to figure out ways to decrease their work and unburden them, we should be collecting that data and then using that data to automate other services, not throw it back at the clinicians to do something with it.
Very good. I want to wrap this segment up with a lightning round question. I'm going to ask each of you simple, short answer. We've been talking about consumer and consumerism in healthcare at least since the 90s. We have businesses, we have these new platform business models emerging, all in the hope of that, and yet we all know very much that this still doesn't feel like as very, very consumer-oriented compared to other sectors of society. Look forward 5 years, simple question. 5 years from now, are we a little more consumer-oriented or a lot more consumer-oriented? You have 5 years of runway. Jeff?
A lot more.
A lot more. Mike?
A little more.
A little more. Susan?
I'm in the middle. I'd say a little more.
A little more. Roy.
Less.
Oh boy.
Yep.
Well, nothing like an uplifting note around the role of consumers to wrap this segment in. Roy Schoenberg, Susan Wood, Mike Cantor, Jeff Laux, thank you for joining us. Thank you all. Thanks for having us.
Devin asked me to mention some sunglasses that are evidently available up at the front desk. So if you're missing a pair, please get them. Name tags. There are 2 bins, one for those who are joining us tomorrow, which we hope you all are, and one for those who sadly must go on to do other things. So that's a couple of quick announcements. Randy's going to share a couple of kind of thoughts on the day. I'll share a couple and then close us out.
Yeah, my thanks to our panel chairs and our panelists. What a great group. I hope you'll all give them one last round of applause before we send them off.